Well, Africa is a big issue. I usually hear that Africa will be the future, but I'm very certain that Africa is the present. Nothing can happen in this world without Africa. That's why we think that people should know about the epidemiological transition that is happening in Africa. When we look on TV, at the TV, when we read the newspapers, we always talk about communicable disease like malaria, TB, HIV. If you consider the total death from Ebola for over 6 months now is 7,000 deaths. 23 to 30,000 people are dying every single day from cancer in Africa. And then, if you consider the demographic growth, by the year 2013, 70% of the new cancer cases will happen in Africa. So non-communicable disease, including cardiovascular, respiratory problems due to tobacco, diabetes, and cancer will be the #1 killer in sub-Saharan Africa in the 10 coming years. I think that what we have to do first is to put cancer and NCDs in general on Africa Health agenda. We need to advocate at the highest level, at the Ministry of Health, at the government, to try to put cancer in the agenda, to put NCDs in the agenda. We hopefully managed to send it to African Union last April 2013, the aortic cancer plan to the African Union Health Minister Committee. And we did the same last February when I presented before the Minister of Health of the Economic Community of West African States the challenges and perspective of cancer in Africa. And I think that's the way to go. We need to advocate more. We need to raise awareness into the population. We need to think about normograms. We need to have cancer registries. We need to have more accurate data than we have now to tackle this issue, which is definitely, to me, the real threat to Africans instead of sticking on communicable disease only.
Okay. There's a big training element, a big education drive needed. Who needs to be educated in Africa?
Everybody. Educating people by advocating. And in advocacy to raise awareness. Educating people for prevention, because prevention to me is the key. And after prevention, those people who have cancer should be diagnosed earlier, for early detection, educating people for that. Education people for treatment. And hopefully we are having more and more patients coming in at an early stage, so they are amenable to curative treatment. Those people should be taken care of. And we need to train the specialists in any specialty. And for that, my preference would be on-site training. Instead of sending African people, doctors, residents to Europe or to United States, and try to train them in a very different environment, and lose some of them because they're going to stay there, not going back home. My preference would be to organize training regionally, and when we bring the experts, when we get the equipment, we will teach once, but we will teach much more than if we send someone outside. But we need to set up collaboration. Collaboration in training, collaboration in research, because where the cases are, where the research materials are. But Africa cannot stand as a sample provider, just getting samples, sending to the lab outside. We need to develop meaningful partnership that will build capacity in Africa.